Sessions during today's presentation. You may ask a question at any time throughout this event by typing it into the Q&A panel located to the lower right of your screen. With that, I'd like to introduce you to your first speaker today, Donna Jacob.
Thank you, Richard, and good afternoon, everyone. Welcome, and thank you for joining. Let's talk about health. I am Donna Jacob, Senior Vice President at the University of Maryland Medical System. I will moderate today's community conversation. Our Let's Talk About Health series is designed to increase awareness about important health issues, provide people with tools to help maintain or improve their health, and create better, more rich conversations between medical providers and patients. Today's topic is pharmacy and medication management. Taking medications can be complicated and confusing to people. Our presenters today are here to help unravel some of the mystery and confusion around taking medication and managing your own health or family members' medication, whether they are purchased in a store, also known as over-the-counter medications, or prescribed by a medical provider. We have three speakers with us today, two pharmacists and a physician. Asha Tata is a pharmacist who works with one of the medical teams at the University of Maryland Medical Center. She received her Doctor of Pharmacy from the University of Pittsburgh and completed a pharmacy practice residency and an adult internal medicine specialty residency at Virginia Commonwealth University Medical Center. She's the director of the pharmacotherapy residency program at the University of Maryland. Dr. Tata has received numerous awards for leadership and teaching skills and is very engaged in ensuring patient safety and quality standards. Teresa Brush received her Doctor of Pharmacy degree from the University of Maryland. She completed two residency programs, one at Suburban Hospital in Bethesda, Maryland, and a second at the University of California, San Diego Health. Prior to joining UMMC, Dr. Brush worked at the Greater Baltimore Medical Center as the Pharmacy Transitions of Care Coordinator. She joined the medical center in early 2020 as a clinical pharmacist, leading the Pharmacy Medication History Program. Dr. Mengla Gulati is the Chief Quality Officer, Vice President of Patient Safety, and Associate Chief Medical Officer at the University of Maryland Medical Center. She joined the University of Maryland in 2004 as an academic hospitalist. She's a clinical educator teaching medical students and residents, and she also holds an important leadership role in the preeminent Maryland chapter of the American College of Physicians. And they will speak to you today in that order. Before I turn this over to Asha, let me reiterate a couple of things that Richard mentioned earlier. This conversation is meant to be interactive, so please feel free to type your questions and answers, questions that you may have in the Q&A box, and our presenters will be happy to address them at the conclusion of their presentation. Both the video that's being recorded today and the presenter's slides will be available to you electronically in a few days, and I'll share the site where you can access both of those later in this conversation. And with that, Asha, would you please?
Great. Thank you, Donna, for that introduction. And thank you to all of you joining during your lunch hour for this very exciting topic. So Dr. Gulati, Terry, and I are very excited to speak to you on something that we deal with on a day-to-day basis, and we hope that we can share some tips to help you all take your medication safely at home. So we're going to start with the patient's story. So we're going to tell you about Mr. Snow, and this scenario is actually more common, and maybe some of you have actually experienced a very similar scenario. So Mr. Snow, he's a 75-year-old man. He fell and broke his hip while taking a walk. He was then admitted to our hospital for a repair of his hip. He came into the hospital and he knew he was taking two different medications for blood pressure, in addition to some other medications for other medical conditions, but he couldn't remember the names of them at the time. While he was in the hospital, he underwent a hip repair and was started on two new blood pressure medications. When he was discharged from the hospital, he was prescribed the two new blood pressure medications that they had been working for him in the hospital. So when he got home, he took the 2 old ones he already had and the 2 new ones that were prescribed to him during his admission. And now he had a supply of both, and he took all 4 blood pressure medications. He started feeling dizzy and lightheaded, didn't know what to do, so he called his primary care doctor for advice.
As I mentioned, these sessions really are geared to help people understand when they may have a problem and then how to communicate with the provider. And the format that we've taken to do that is called Ask Me 3. So it's important that patients think about 3 things when they're talking to a medical provider. What is my problem? What's the main problem? What do I need to do about it? And then why is it important to do this? So we're going to use that format, and Asha's going to go back to the patient's story and give you 2 different scenarios where you could apply those questions to a circumstance like this. But it's just really important in the future to remember those 3 things. What's my problem? What do I do about it? And why is it important?
So I think this is a great way to engage in your care at all the different, scenarios and settings and appointments that you go to. So if you remember Mr. Snow, he took 4 blood pressure medications. He became lightheaded and dizzy. And so the problem here is really that Mr. Snow maybe did not have the opportunity to ask questions while he was in the hospital before he was discharged. So it's very important that during a hospital discharge, you make sure you know what medications you're supposed to take and how to take them before you leave. How do you do that? Well, you're always receiving discharge paperwork before you leave the hospital. So asking the nurse, the pharmacist, the physician provider, or any other provider as part of the healthcare team before you go is an important thing to do. And then why is it important to do? This will help avoid any confusion when you get home about which medications you're supposed to continue and which medications you might have been told to stop taking. And this ensures that you take your medication safely and correctly. Similarly, the other problem here for Mr. Snow was that he was unable to remember all his medications he was on before he came into the hospital. So the problem here was an incomplete outpatient medication list on hand while the patient was in the hospital. So what can you do is to keep an updated medication list at all times on hand wherever you go to any appointment or any hospital setting. And again, why is this important to do is to avoid any unnecessary medications that are going to be ordered or prescribed for you and to make sure that everyone is clear on what your medications are when you leave the hospital. So why does this matter? And I'm sure that most of you agree that your healthcare is not in just one setting. You have your primary care provider who helps manage all your medical problems and medications, keeps track of you. You probably see your primary care provider more than once a year in some scenarios. He or she is the person you call when you have an illness or need something. However, you also have lots of other clinics that you go to. You may see a specialist, a heart doctor, a stomach doctor, a lung doctor for any special conditions that they may need to help treat you. You may go to a procedure clinic just to get a small mole removed or get a surgery that's a same-day procedure. Unfortunately, you may get admitted to the hospital for something more severe. And then when you leave the hospital, you may end up at a rehab center to get stronger for a couple weeks or a couple months, depending on how bad how bad your strength was when you left the hospital. And lastly, don't forget about your neighborhood pharmacist that you may interact with whenever you're picking up medications from all of these different facilities. So you can see that medication may be prescribed in all of these settings, something new, or different doctors might tell you different things of which medications to stop and which medications to continue. The problem is, unfortunately, all the medication information is not available electronically between all these settings. So, your primary care doctor's office might be a different medical online medication system than your clinic or the hospital or the rehab center. And this is why it is really important to keep that updated medication list on hand with you at all times. So when you go to your outpatient provider, how can you safely manage your medications? As we've said a couple of times, you'll hear all of us say this over and over again, is to bring that updated medication list with you. If it's too hard to write them all down, you can even bring your prescription bottles, because then the doctor or the pharmacist or anybody that you're seeing in the clinic can actually look at the bottles and see what you've been prescribed. They can see the directions, they can see what you have left, and that can help make their decisions during your appointments. The other important thing is to review all of these medications with the provider at every visit. You know, if I were on, say, 10, 15 medications, I'd want to know, can I get off of any of these? Or do I still need every single one of these medications for my conditions? And this is a good ongoing conversation to have with your provider. If a new medication is started at one of these appointments, make sure you understand what it is, what it's for, how to take it. Is it best in the morning? Is it best in the evening? Is it an oral medication that you take by mouth, or is it an ointment or a ear drops, or some other formulation that you may not be as familiar with? And then why you're taking it and how long you're going to be taking this medication. And I would say be honest with your provider about how you're taking your medications. If you didn't like the way it made you feel, or you didn't like or if it cost too much money, or something that was just not comfortable for you, it's important to talk to your provider about those things, because they may add something new because they didn't know you weren't comfortable taking that medication. So it's important to be honest with your provider about if you were taking it, how you were taking it, and if you've had any problems. Ask about side effects, what to expect, and that way your provider can tell you the ones that really matter, the ones that you really should be watching out for. So the bottom line, ask questions and be engaged in which medications you're taking and why, and don't be afraid to speak up. On the other hand, when you get admitted to the hospital, again, bringing that updated medication list is really going to be crucial in the care that you receive during your hospitalization. Again, if you don't have that medication list and you have your bottles with you, that's important to show the different physicians or pharmacist or nurse or whoever you're interacting with. If you have any questions about the medications you're receiving in the hospital, that might be different than the ones you take at home. So you should ask, you know, what medication you're receiving when the nurse is giving it to you during your hospital stay, especially if it's something new, why you're receiving it. Being engaged in your care can help answer all your questions throughout your stay and eventually when you go home. And finally, you know, when you're leaving the hospital, you're notified about any new medications that are started, anything that might be stopped. And then finally, some medications just may be adjusted, whether it's a dose or the number of times per day. All of these could impact what you do when you leave the hospital. And then when you leave the hospital, you get paperwork that talk about what these changes are and an updated list of your medications. Please make sure to take those with you at all of your visits when you leave, and it'll make it easier for you as well as your different providers that you see.
So as Asha mentioned, one of the most important things that we talk about is keeping this updated medication list. So you may be wondering, what does this medication list actually look like? What should it include? So when you're thinking about medications, and we'll talk a little bit about this in the next slide, we're going to think about both prescription medications as well as non-prescription or over-the-counter medications. On your medication list, you should include as much information as possible. So the name of the medication, both brand or generic or whatever you recognize in terms of what medication you're actually taking. The dose of the medication, so how many milligrams or micrograms or how many units you're taking of that medication, how often you're taking it. Are you taking it every morning? Are you taking it at nighttime? The route that you're taking it. So most medications, oftentimes we think of just oral medications, but it could be something else. Maybe you're using eye drops. How many drops of that are you taking? Maybe you're using ear drops or patches. And then again, that time of day that you're taking it. For certain medications, it's really important that you're taking it at a certain time of day. And so we want to know that when you're sharing this medication list with your providers. So it's very important. I think one of the hardest things is to update this medication list. You know, you have this medication list on hand and sometimes you forget to update it. It's really important that as you move through your clinic settings, if you get admitted to the hospital, if you go to some kind of rehab facility, that you keep an updated medication list. There's going to be changes that occur, I can guarantee you. And so one of the things that you could do is you could write a date at the bottom of your medication list. And as these changes occur when you're in clinic, you bring that medication list with you, and then you can write a new date if any changes are made, and update it as it goes along. You can keep this in either written or electronic form, whatever works better for you, because you want it to be easily accessible in all these different settings. If you want to keep a list on your phone and just have it easily so that you can easily update it when you're in clinic or if you're with a specialty provider. And then the last thing is ensuring that your family or caregiver has access to this information. When you're in these different settings, you're not always going to have that another person with you. But it's important that everyone is aware of things that might have changed so that if they do get contacted about your care, or if you need to involve them more in your care than previously, that they know what's going on with you and what you've been taking at home. So I mentioned already that there's two main, categories of medications that we want you to focus on. So the first one is prescription medications. It's the one most people think of. So this is where you're going into the pharmacy and you're picking it up, or it's being delivered to you. So these medications, they're nice because it provides you exactly how you should be taking on the label, how you should be taking this medication, one tablet every day. On the other hand, non-prescription medications are ones over the counter that you can buy. You walk into an outpatient pharmacy and maybe you need some Tylenol for your pain. So these are those medications that you can pick up without actually going to the pharmacy counter or getting a prescription from your provider. Something to remember about these over-the-counter medications is it's not just the Tylenol and the Claritin it also includes such things such as vitamins and supplements. So if you're taking vitamin D, if you're taking calcium at home, all of these things your providers want to know. So these are all things that we want you to include on that medication list. Over-the-counter medications can interact with other prescription medications you're taking, and they can have an effect on other conditions that you might have. So it's really important that you take note of everything in terms of vitamins, supplements, over-the-counter medications, as well as prescription medications on that medication list, so we can have a complete history of what you're doing at home. So specifically talking about non-prescription medications, I mentioned that prescription bottle. It's really nice. It has that directions as to how you should be taking something at home. Non-prescription medications are a little bit different. You'll see on the right-hand side here this picture of the back of one of those non-prescription meds. It's really important that when you buy a non-prescription med or you're thinking about buying it, that you look at the drug facts that all of these medications have. So it'll have the active ingredient within that non-prescription medication. And it'll also tell you what to expect from this medication. Are there side effects you should be worried about? And what actual dose, how often should you be taking it? Should you take it twice a day? Can you take it up to 3 times a day? And so any non-prescription that you start taking, ensure that your primary care provider is aware of what you are taking. Especially if you're starting to take it regularly. Again, as I mentioned, these potentially can have an impact on other medications you're taking or other conditions you might have. So it's really important that you talk this over with your primary care provider. Those drug facts, those are very important because it'll include all of the active ingredients in non-prescription drugs. As you might have noticed, when you go into that pharmacy to pick up something, for instance, for your cold, there are a lot of combination non-prescription products out there now that contain, up to 3 to 4 different medications. So it's important that you compare and contrast. What do I actually need this for? If I need a decongestant because I'm congested because of my cold, do I really need a cough suppressant too? So look at the back, read over what these are going to do for you and what you can expect from these medications, and try and keep it simple. If you just need a medication for your congestion, then just pick up a medication for your congestion. And then in terms of non-prescription meds, they're really only meant for short-term use. So if you have that cold and you take it for a couple of days, that's totally fine. But once you start using it every single day, this is something to have a conversation with your provider about. It's just for short-term use. There are potentially, harmful long-term effects sometimes. And so it's important that if you're needing something every single day, that there's a bigger conversation with your provider about why you're needing that every single day. All right, so we're going to talk a little bit about medication storage and disposal. So starting with storage, one of the first things we think about medications is most people keep it in their bathroom, right? So this is something that we definitely discourage. Medications, it's very important that you keep them in a cool and dry location. The reason that this is suggested is because certain medications can become less effective in a warm and wet environment. And so if you're not feeling the same effects from a medication, it's not working as well, it's potential that the medication is no longer as effective because of how it's being stored. So it's important that you keep it cool and dry. Also, that you keep your medications out of reach of small children, other family members, or pets. So if you keep it maybe in a locked cabinet, that's a potential, or, for children, maybe on a higher shelf than other things within the house, so that people can't get into it, that you don't want looking at or taking your medications. In terms of storage too, a lot of people use pill boxes to help them organize your medication. It's a very effective tool. There are lots of different pill boxes on the market. Some of them contain, multiple times a day for the different days of the week, and it's very helpful. One thing though about pill boxes is that once you organize your pill box, sometimes it's hard to remember which medication is which because they all look different. So sometimes it's helpful if you leave at least one tablet of medications in your prescription bottle so you can go back and actually look to see, okay, what medication is this in case any changes occur once you filled your pill box. Now, in regards to disposal, I have included a link here. Drug disposal is something that is pharmacists out in the outpatient setting are very aware of this, and a lot of outpatient pharmacies now have drug disposal boxes. And so this website does include different sites that you can go to, and you can also talk to your outpatient pharmacist about if they have a drug disposal box on site or if they know of one close to where you're picking up your medication. Also, a lot of the medications, specifically prescription medications, within the handout that you receive when you pick up your meds, it does oftentimes have disposal instructions. So read that over, see if there's anything. If there are no specific instructions for safe disposal, you can do home disposal of oral medications. Follow the instructions first off, but if they don't have instructions, you can mix your medication with an undesirable substance, such as coffee grounds or cat litter, seal it in a sealable bag, and then dispose of it in your home garbage. Remember, prior to doing this, scratch off any personal identifying information on the label just to keep your identity safe.
Thank you, Teresa. So now a little bit about advocacy. So we'll start with us as patients. We are our own best advocates in all aspects of our healthcare. If you are a patient within the University of Maryland medical system, you have the ability to access your medical record through something called My Portfolio. If you are receiving your care in another health system, you can still receive access to your healthcare record through whichever electronic medical record your provider is using. And this is called a patient portal. What kind of information can you find in the patient portal? You can find information such as medication lists, results of some lab tests that you may have had done. You can find physician or provider notes in there. And you can also find discharge summaries. And a discharge summary is a summary of the care that you received if you have been recently hospitalized. In case your provider does not have an electronic medical record, you can still request paper records. Again, you just talk to your provider and they can provide all of this to you. It's very important that you keep copies of your records safely so that in case you move to another state or another area completely and you don't have access to those records electronically, at least you have those paper records available to share with your new providers. Always feel free to call your primary care provider or if you have a home health nurse, if you have any questions at all about medication. Again, very important to keep an eye on the date of expiration or the use by date on all of your medications. And it's extremely important to make sure that no one else in your family or friends take any of the medications that are prescribed for you. And this is the reason we prescribe medications, is because those are medications that have may have certain interactions with other medications. They need to be taken a certain way, or they need to be given at certain times. So again, the prescriptions that you receive from a provider are very specific to you as a patient. Cannot emphasize enough, keeping all medications in a safe place at all time, as we mentioned before, to keep it out of the reach of children, away from your pets, and also to keep make sure it's safe from people that may have dementia, who may not recognize that these are not their medications and may inadvertently take your medications, and that is definitely a potential for causing harm. On the next slide, we're going to talk a little bit about if you have a family member or a caregiver that is helping in your care, it's really important that they understand and know all of the medications you're taking. So if you have a medication list, it's important, if you're comfortable giving it to them, that they have that medication list in case they need to speak on your behalf. They may be the ones that are actually giving you your medication, so they do need to know what time of the day it needs to be given. Is it to be given with food, to be given after food? Do they have to give you 1 pill once a day or 2 pills once a day? So those are very important instructions for your family member or caregiver. It's also important they know how or where your pharmacy is, so they can make sure that you have refills when they are needed. And also they can, it's very important, some of the information that Teresa shared with you about reading the medication labels, so that they're also very comfortable reading medication labels to make sure that they're giving the right medication at the right time and the right dose. You as a family member may be the one who is at the bedside when your loved one is admitted in the hospital. And as a family member at the bedside, often if we feel the need to, we will talk with the family member and the patient at the same time to go over the medication lists and also make sure that they're comfortable giving the medications. Now, some medications such as insulin, which is an injectable medication, often if the patient is unable or uncomfortable to administer that to themselves, we'll teach the family member to do that. So very important to be involved in the learning of some of these medication administrations. On the next slide, you'll see that one of the resources that is absolutely invaluable is your outpatient pharmacist. Outpatient pharmacists are an absolutely phenomenal resource, and they are an invaluable member of the healthcare team. An outpatient pharmacist, while they practice in the outpatient setting, they absolutely do understand medications that are prescribed when you're admitted to the hospital. They understand how those medications, when you're discharged from the hospital, may interact with any new medications that you're prescribed after your hospital discharge. They are there to answer any questions when you're picking up your prescription medications. They can answer any questions about over-the-counter medications, such as medications for headaches and colds. They can also help with any potential interactions of your prescription medications with an over-the-counter medication as well. So if you have a question and say, I'm taking these 2 blood pressure medications, I'm looking for something for my cold, they'll make sure that those medications are not all interacting and causing any unintended side effects. They also can talk about any concerns you have about allergic reactions, and they can guide you with alternative medications or when to reach out to your primary care or your specialty provider. They can also help you understand a little bit about this very complicated world of when certain medications require our insurance companies to provide almost a pre-authorization. That means that the insurance company has to say it's okay for you to prescribe these medications. And our pharmacists are definitely experts in navigating the insurance companies to make sure that we get the right medication for all of our patients. The other thing is, I think it's really good to always remember that while our outpatient pharmacists are there to the experts on medications, they also are very, very important in providing or answering any questions you have about your general health. And also, they're a great resource if you have any questions about vaccinations or immunizations as well. So to kind of summarize the key points from our conversation with you today, on the next slide, you'll see that really it's so important to keep that list of your current medications, keep it updated, make sure you have that list, either put it in your purse at all times or in your wallet, or jot a list down in your phone so it's always accessible to you. Making sure that your medications are stored in a safe place, both because we want to make sure they're maintain their effectiveness, and also so that they're not falling into either friends, families, or young children's hands. Take your medications as prescribed. The reason we prescribe medications in either 1 pill a day or 1 pill twice a day is because it's the way the medication acts in the best way possible. If the label is too small on your prescription bottle and you're having a hard time reading the instructions, you can always ask for a larger font, and the pharmacy will be happy to give you a larger label that's easier to read. Often we see in patients who have arthritis or inflamed joints, it's difficult to open some of those bottles because those bottles are designed to be safety bottles so that young children can't open them. But if it's difficult for us as a patient to open them, the other bottles that are much easier to open are available if you request for those. If you're taking a trip somewhere, taking a few days away, make sure you have enough of your medications to take with you. And also, it's really important to remember that if you're getting close to running out of your medications, is to call the pharmacy, and if you have any refills, you can either set up an automatic refill process, or you can ask them to refill your medications so you don't run out of medications. The other thing I would say is that medications is just one thing that we have to take care of ourselves. Also, make healthy choices when you're choosing your diet. Healthy choices when you're exercising, even a 10 to 15-minute walk a day, if you can do that, is a great way to start moving. And also make sure you get enough sleep. Often we underestimate that's how important sleep and rest is to all of us. So take time to take care of yourself, for yourself, and for those that you're taking care of. And thank you for inviting us to have this conversation, very important conversation with you today. And we look forward to answering any questions.
Thank you so much for that information. It was so enlightening and some very, very practical tips. In addition to what you said about diet and exercise, I think water is something that's also important that sometimes people underestimate the need to drink water. So appreciate all of that. We do have a few questions. There's one here, and we're not going to be able to answer questions that are particular related to you and your medicine necessarily, but there's a question here that starts with, I was prescribed Eliquis for AFib. And I mentioned that, but I think the content of the question is relevant for many, many circumstances. And the content is this: I was advised to take it every 12 hours and that was very important to take it to close to the same time each day. I had a sleepless night and I woke up 2.5 hours later than normal, so I took the medicine late. But I don't want to have to stay up late every night in order to be on that same time frame. What can I do? Can I reduce it by 15 minutes every day? What do I do to get back to a decent time?
That's a great question, Stephanie. It actually happens more often, and it's normal to fall asleep early one day and maybe not so much the next day. So I always tell patients, try to take medications as close to your normal schedule. And sometimes in the hospital or, at facilities, you might be getting medications at a different time than what's normal in your home schedule. So if you're, an early riser and you're up at 6, 12 hours apart, 6 and 6 is totally fine. On the other hand, if you're a later riser and, in your schedule, it's easier to take it at 10 and 10, that is also totally fine, but just kind of adjust to your day-to-day routine. And it depends on the medication for which one you can take as close to the time. So for Eliquis, for example, I would say 1 to 2 hours within your timing is probably fine. Some other medications, we may say if it's too close to the next day, just skip that day and go back to your regular schedule. So it kind of does depend on the medication itself and the type of medication. But in general, for Eliquis, I would say within 1 to 2 hours of your normal time should be just fine.
Great. Here's a question I never contemplated, and it is, are prescription bottles recyclable, or should we just throw them away after we remove the label? So you look like you're going to answer.
Sure, I can take that one. So yes, they are recyclable. I do want to remind everyone, though, that if you are going to recycle them, to take off your label, because that is your personal health information. So take off that label, rip it up, or put it in a shredder if you have it, and you can go ahead and recycle those prescription bottles.
What are your thoughts about mail order pharmacy? you've all mentioned how great a resource your local pharmacist is. We said retail outpatient pharmacy. So I just want to say to the audience, that's your giant pharmacist or CVS or someone that you meet in a circumstance like that. But what about mail order? Does it work?
Sure. So we did mention mail order, and I think mail order is becoming more commonplace. I think certain insurance companies are strongly encouraging you to use mail order over regular outpatient pharmacies. I think the nice thing about mail order is it's coming directly to you, right? So you're at home and it is getting delivered to your place of residence. So in terms of convenience, it's very convenient. Also, nice thing about mail order is they can do those automatic refills. So if you get a 30-day supply of your medication, it's automatically going to come to you so that you can be ready to go for that next 30 days. Mail order pharmacies also have pharmacists on call or people or call lines that you can call when you have questions. So we did talk a lot about the potential questions, or if you have concerns that you can talk to an outpatient pharmacist about. If you have those same questions, mail order pharmacies have those same resources for you. And so that's all included in that packet of information when you get those prescriptions. But if you have questions that you would like, you don't have time to call someone, or they're more specific to something you want to go in person, if you're picking out an over-the-counter medication, you can always go to a pharmacy and ask the outpatient pharmacist there as well. So you kind of have more resources available to you. I will say that if you need a prescription filled very quickly, I would definitely suggest that you get that prescription filled at an outpatient pharmacy in person so that you can pick that up directly versus waiting for that mail order, because you just don't know how long, especially with all the delays in delivery, how long that's going to take to get to you.
Okay. Taking your medicine in specific doses can be complicated, the question says. So for instance, it says, take one pill twice a day. Is that one pill every 12 hours, one every 4 hours? Or can you take them both at one time? And then the other part of the question is, how do you best measure liquid doses? Can you use teaspoon, tablespoon from your drawer in the kitchen? Asha?
So in terms of the, that's a great question. So twice a day, most of the time, if it's a twice a day medication, I would say it should be as close to 12 hours apart. But on the other hand, it could be a medicine that should only be taken before a meal or with meals. So those are not going to be quite 12 hours apart necessarily, because you might eat breakfast at 8, 9 a.m. and dinner at 5 or 6 p.m. So it's not quite 12 hours apart. So I think it's important to ask your provider, depending on what medication that is. So asking explicit questions. So I think as providers, sometimes we fail to provide those explicit instructions. So there's no such thing as a silly question in anything, in my opinion, and especially when it comes to medication. So to clarify what that twice a day or number of times per day and how that should be adjusted is a good question. And then I think you were asking about form of liquid medications.
Yeah, liquid. Yeah, can you just use your teaspoon?
So technically, ideally you should be getting the medication cups that they dispense with your medication, and most of them can do that. If not, if you have an accurate measuring teaspoon or tablespoon, that should be fine. But usually most medications do come with a specific cup for liquid medications.
If someone has high blood pressure, how do you know which medications to stay away from? So for instance, there are lots of cough medicines that you learn over time you should not take if you have high blood pressure. How does somebody know what to use and what not to use? Teresa?
Sure. So it is difficult. I think that the best thing to say is I think you need to use the resources around you when you're trying to pick out those medications. So there are specific, when you're looking, for instance, if you're trying to get a cough medicine or get a cold medicine at the outpatient pharmacy, I would suggest that certain ones do say okay for blood pressure on them, or also another category would be something like okay for patients with diabetes, but also ask the question of the pharmacist there. I have high blood pressure. What medication would you suggest using for a cough? So use those resources that you have there when you go to pick up the medication and ask those questions. It's going to be hard for me to give you that complete list right now, but use those resources so that if you need a specific outpatient or over-the-counter medication, talk to the pharmacist on staff there and ask specifically given the conditions that you have.
One of our viewers wrote a note that mail order is great, and it can also come in individual packets for each dose, and that's really helpful. And it has the medicine name, the dosage, the date, and the time on each package, and that they get them through Amazon. So somebody liked that. One of the messages
Donna,
that you guys have communicated.
can I interrupt and make a comment real quick? I think those pill packs are great as well, but I will caution for those of you whose medications might be changing because they haven't quite found a stable regimen. Be careful of those pill packs because you can't then change if you go to see your primary care doctor or a specialist and they change your dose or the number of times per day. You won't be able to adjust those packs right away. So then you have to keep track and make sure that you're taking the right doses. So I think those pill packs are great for anyone that, their medications are not really changing at all. And it's pretty much the same thing. You've been taking it for years. I think that's really the best for those. But yes, those are everything through Amazon makes it easier now, doesn't it?
Well, they come to my house every day. So that's great advice. I've got one last question here, and one of the points that you all have made is using your pharmacist as a resource and how much information they can really provide. I don't know that people know that or necessarily that comfortable. So there's a question that I think, Teresa, you spoke about the drug label on the back of your over-the-counter medications. A lot of those words, most of us don't understand. They may be a common language to you all, we don't understand that. How comfortable should we be taking that box and walking right over to the pharmacist and saying, help me understand my circumstance and this medicine?
Yeah.
Dr. Galati or Teresa?
No, Dr. Galati, go ahead.
You should be extremely comfortable with taking that bottle and going asking the question. Because again, I cannot emphasize, not only in the outpatient arena, but even in the inpatient arena, we rely on the expertise of our pharmacists, and they will be very happy to answer any questions. Any question you have about anything specifically around those labels, because they can be confusing. So absolutely. I did want to mention, and I did forget to mention this before, that if you are actually admitted to the hospital, the question may come up, should I take my own medications, my pills and my ointments into the hospital with me? And the answer to that is usually you don't need to do that, because we often, if we don't have exactly the same medication you need, we can substitute it for the appropriate medication. Now, if you do happen to take your medications in with you to the hospital, it's very, very important you give it to your nurse or your provider, because we'll make sure we store them for you appropriately and safely, and we'll give them back to you when you're ready for discharge. So we do not encourage people to self-administer medications when they're in the hospital, because there's always a chance you may get 2 doses of something similar, which may cause an unnecessary reaction.
That's very good advice, and something we don't think about. First of all, no one's trying to be in the hospital, but you don't necessarily think about what do I need and, should I take it and how do I handle that? So thank you for that. All right, those are the questions that we have. Oh, wait a minute. Okay, those are I want to make sure nothing else came in. Those are the questions that we have for today. And as I mentioned at the top of the hour, we will have this presentation, there's another slide here, available for you all to see again, should you like. You can go to our website in about 48 hours at www.ums.org/letstalk. And this presentation will be posted together with the slides, so you can review all of that once again. As well, you can look back at any of the other programs in our monthly Let's Talk series, and they're listed there for you. As is our tradition, on the next slide, you will see the 3rd Wednesday in every month, we do something related to Let's Talk and a new topic. The topic next month, I'm sure, is going to be also very popular, and it's headaches and migraines, and that'll be on Wednesday February 16th, again at noon time, so you can join during our lunch hour. I want to thank the three of you for the time and effort that you've put into this and for your really, truly helpful comments today. Much appreciated. Audience, thank you for joining us, and we'll see you again next month.
Thank you, everyone, for joining today's presentation. This does conclude today's event. You may now disconnect your line.